Lee Carisco. Lee Carisco is a radiologist, neuroradiologist, and he's practicing in Minnesota now. But Lee grew up in Canada, and he thought growing up that Canada was the most moral system because it treated everybody. Well, he believed that right up until he was a doctor. He went through medical school and got out. He was in Thunder Bay, and he found that they didn't have equipment, they had physician shortages, and they had total lack of freedom. Here's the story he told me about the day he decided to move to the States. And this really, I always remember this because it's really kind of a heart-wrenching story. He was reading CT scans. Now in Canada, he had 3 CT scanners, but only one of them worked at any given time because there's no incentive for the government to fix things. They're better off on their budget if it doesn't work because they don't do as many studies. You know, in this country, profit motive makes us have these available. You know, you buy a CT scan, you make a capital investment, you want to pay it off, you want to do CT scans. So you come in, I get you a CT scan anywhere in America within an hour at a reasonable cost. Actually, the cost could be lower if we got rid of Medicare. But in any case, I can get you the study. Now in Canada, unfortunately, because of the shortage of equipment and everything, it takes somewhere between 3 and 9 months to get a CAT scan today in Canada. And so his job was, your local family practitioner would fill out a form and say, this is why I want the CT scan. And then Dr. Carisco's job was to get all these forms and try to prioritize who had to go up ahead. Well, if somebody said they thought he had a brain bleed, that would get to the top of the stack. This patient that he remembered, it was low back pain. Well, low back pain can be a chronic condition, so that one went to the bottom of the stack. Unfortunately, when the guy got his CT scan several months later, he happened to be also the doctor that read it, and he found that the guy had a tumor in his spine. Might have been treatable 4 months ago, but now he's way out. So he felt like he had killed the guy because he had to make that decision. He says, I felt like those German doctors on the selection at Auschwitz deciding who went to the death camps and who went to the workplace. And he said, I never want to be in that position again. And that's when he started studying to come here. Now, the other Canadian I want to tell you about is Jacques Shaoli. Jacques Shaoli grew up in Paris or somewhere around that. And he decided to move after his medical training to Canada. He's a family practitioner. He wanted to move to either Canada or the US. But he decided on Canada for the same reason. He thought it was more moral to have everybody covered, right? And so he got up there and he found out that his patients were dying for lack of basic, simple things that he could get them across the border. And not only that, they were dying because they waited 9 months for a CAT scan, but a dog could have a CAT scan within 2 hours. Why? Because the dog paid cash, but it was illegal for Canadian citizens to pay for anything, even though it was not available to them. So up in Canada, they run the CAT scanners during the day for the government people, and then at night they shut them off at 5 o'clock and they make cash payments by animals. Kind of crazy, but that's what they do. But anyway, God love Dr. Shaoli, he took on the province of Quebec. He used his own money and his own, he studied, you talked to him, it's almost like, oh, okay, Jack, you know, you're talking like a lawyer, you lost me way back there. But he studied, and he actually, for 10 years, he and his wife prosecuted the province of Quebec to allow free market medicine, fee-for-service medicine, and they made it legal. It was legal 2 years ago, thanks to him. And the funny thing is, he's being hailed as the hero of the proletariat, which I think, if you know the history of the Soviet Union, it's kind of funny, because that was always the socialist thing. You know, you're the hero of the proletariat if you beefed up the collective farm, but now he's the hero because he's got free market medicine. Great guy. You know, I keep this up to date. If you look at, the other thing we always hear is it's so expensive to get health care here compared to other places. In 2012, the budget for the National Health Service in Britain was 130 billion pounds, which is the equivalent of about, well, I figured it out at the time. It figures out in Britain, they're paying about $3,200 per citizen per person. They've got 64.6 million people. In dollars, it's $3,200 a person for their health care per person, okay? Now, my son's 23, 24 years old, he's healthy. I get him insurance for $45 a month. And when you put all our family together with a premium plan, I was paying $1,800 a month. Ralph was telling me that these plans that he's doing between $900 and $1,800 a month per person. What's the difference? Well, they paid nearly twice as much, but also they got shitty care. I got top quality health care for my insurance. In Britain, they just celebrated a couple years ago that they thought, hey, we finally turned a corner. Less than 1 million people waiting for surgery, and then, oops, not so fast. I read in the UK Guardian 20 February, they're back up over 1 million. It was just a little blip there. They didn't go down. At one point, they were going to train nurses to do open heart surgery on the idea of equality of job description, but it was really because they couldn't get enough cardiac surgeons to work in their stupid system. Now, I apologize, this is kind of a blurry slide, but this slide, Lee Carisco had this one time. This is, people think that in Canada, everybody's got a doctor, everybody's got health insurance. It's a beautiful nirvana of healthcare. It turns out 15% of British Columbians are uninsured because either they didn't sign up, or they don't have any income, they live under a bridge, they don't have an address. You have to have certain things. We think there's about 15% of people in America that are uninsured, so are they, and that's Canada. But 4.4 million people are insured and have no doctor. They have to wait. This is a lineup of people, and it's stretched around the block behind this person, trying to wait and sign up to hope they can be getting assigned to a family practitioner, because there just aren't any doctors. There aren't enough people to do it. Now, contrast that in America with what we have in our food supply. Think about it. We have the cheapest, most abundant food in the world. And why is that? It's because we have farmers that act independently, truck drivers that act independently, grocers, all who act in their own economic self-interest and bring us the cheapest, best food supply in the world. God help us if the government gets hold of our food supply. But it works because there is no system. So when I hear the Republicans saying, we need to repeal and replace Obamacare. No, you don't need to replace it. You need to repeal it, and you need to get out of the government being in medicine. Let us do it the way we used to do it. Now, there's not too much free market medicine left. About 60% or more of the medical care in America is paid for by the government. But if you find a place where they do free markets, you'll find the cost is coming down, right? Free markets control cost. LASIK. When LASIK first came out for your eyes, it was $5,000 or more dollars. But now I've seen it advertised for $500. On the Mexican border, you can get it for $250 where I was working. Freestanding radiology. They can sell you CAT scans and MRIs cheaper than the government-run places, and plastic surgery prices in real dollars have come down. Now, the AAPS, we have a lot of members that have cash practices. We worry about transparency. Everybody's trying to figure out how can we get transparency in medicine. It's easy, cash. My dad was a small-town doc. You paid him cash at the window. He couldn't cheat you. There was no waste, fraud, and abuse. It takes away all the problems. Cash for outpatient items and insurance for big-ticket stuff. The worst, but here's what I really want to spend some time talking to you about. So I'm going to let Ralph get into particulars, but the worst outcome of government medicine is what it does to us as a society and to us as people. It makes criminals of patients and doctors. How does it make us criminals? Well, first of all, it's based on theft, okay? Our system is based on theft. Nobody here, I could tell in this room, thinks it would be a moral act if I went over to my neighbor, put a gun to her head and said, you need to buy a car for me, or for the lady down the street. That would be considered immoral. But we don't seem to have a problem doing that for Medicare. You have to, I'm going to put a gun to your head and you have to go down and pay for her fractured hip. It does not more moral when you have the IRS wield the gun. I mean, and if you don't think they wield guns, just talk to Leona Helmsley and other people that have been bugged by the IRS lately. But it's just an immoral system, however you want to choose it. And Ralph's got a good story about this, but here's where it ends up going. This is the Japanese finance minister, Tadahasa, and he says, let elderly people hurry up and die. And what he was referring to was the fact is that they're running out of money in Japan. Isn't that a sad social comment? Let them hurry up and die. And he might tell you about that story in Canada. But, my father was a small-town doc. My son's a medical student, so I have a real interest in what this system does to physicians. And I got to tell you a little about that. And the question we need to ask ourselves in a government healthcare system is, do we serve the patient or do we serve the state? And can you do both? So with that, I'm going to introduce you to somebody I've gotten to kind of know, and this is Carl Brandt. And Carl Brandt, this is a picture of him as a young, idealistic medical student. You read about him, and he was a surgeon, and I got interested in him because he was an orthopedic spine surgeon, and he did trauma. And that's what I did, trauma and orthopedic spine surgery for most of my career. And so I kind of get interested, and when you read about him, you think, this is the kind of chief resident everybody wants to work for. He was smart, he worked hard, he jumped in when things needed to be done, he was good with his patients and his staff. I mean, by all accounts, this guy was a stellar physician. But that's not the picture when you see the picture of Carl Brandt that you're going to see on the internet. This is the picture, because Carl Brandt was hung after the Nuremberg doctor trials for crimes against humanity. And the question we have to ask ourselves is, what are the steps that took this good guy, doctor, medical student, into the death chambers at Nuremberg? Okay, he actually, and I'm going to tell you a little about the story. Now, first of all, In 1871, Germany was the peak of medical play. If you want to go study medicine, you went to Germany. They were the top-notch dogs. And it was all really pretty much free market. I mean, you went to your doctor, you paid him. You went to the hospital, you paid it. It was not government run. But about that time, in the 1870s, the Social Democrats wanted to unseat the monarchy. They wanted to overthrow Kaiser Wilhelm. And his advisors said, look, we got to stop this movement. What we need to do is give the German people something so they will be beholden to the crown. Oh, let's give them health care. Because if people are beholden to you for the health care, they're not going to overthrow the monarchy, right? It was a power grab. They set up the first socialized healthcare system specifically, not to treat patients, but to gain power. That's exactly what it was about. And it actually worked very well for quite a while. It worked well for 40 years, okay? But something happened during those 40 years. Things changed how things happened. What was once done by individual ethics and Christian charity to help the poor became this collective ethic of nationalized welfare. Again, things worked okay until the money ran out. You know, you always run out of other people's money in socialism. Well, the money ran out, and in 1929, after World War I, the money started running out, and then the stock market crisis of 1929, it was a big economic crisis. And what was left after all that was no real health care, but just this